Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'll talk a little bit about how could we potentially stop the progression or worsening of COPD or chronic obstructive pulmonary disease. So obviously this is a question that's probably on many people's lips as how do we stop this condition once it's diagnosed. So obviously it's one of the most preventable conditions. So this is something that I need to say from the beginning because basically not smoking, not inhaling a lot of things that are noxious for the lungs, dusts, fumes, etc., that can go a long way as to preventing from getting the condition in the first place. But let's say that's all in the past. That's happened, it's not a question about blaming or shaming or thinking about what we could have done better in the past. It's what we do from this point onwards. So how can we stop this condition once it's diagnosed from worsening? Now, first of all, I'd like to say that not in all cases we can stop the progression. And this may sound a little bit disappointing for some of you watching this video, but I want to be as realistic as I can. It is a condition in which sometimes there can be progression even if you do everything right. And that is, unfortunately, because we are all different. We all have different predispositions. We can be exposed to different infections and so on. But even though that's the case, we cannot control our genetics. We cannot sometimes control our environment fully. We can still do a few things that will give us the best outcome that we can. And the other thing I wanted to say before I get further into this video is to try and think about going and seeing your doctor regularly, seeing someone in your local area, making sure that you're treating everything that you can treat so that you have practical advice and treatment as you require in your specific situation. It's not enough to just look up things online, so you probably need to see a person, a healthcare provider who can actually examine you, give you practical advice based on your own situation. But the first things I'd like to start, so obviously quitting smoking. So this one, again, I may lose some people already because everyone is saying the same thing, but it is really important. And this is, again, something really difficult for many people to stop. It's really hard to quit smoking. But if you have a diagnosis of a respiratory condition that is chronic, something like COPD, people have told you you've got emphysema, there is a bit of damage to the lungs already because of maybe the smoking or some other things, quitting smoking is probably the best thing you can do, even though it's really, really hard. And it may be difficult to quit smoking completely, to quit nicotine completely, but even if you replace the nicotine with a safer alternative, so you go on nicotine replacement, patches, lozenges, gum, etc., but you inhale fewer bad fumes from the cigarette in your lungs, that's probably a good thing. So that's a good first step. The other thing is whether you may want to be on the right inhalers. So this is something, again, where I cannot advise you directly what you need in your specific situation, but you can discuss this with your own pulmonologist, with your own doctor, whoever is treating your COPD in your local area. And just making sure you're on the right inhalers for you, inhalers that are good at treating COPD. Because there's been quite a lot of advance in recent years. There's lots of inhalers now with different combinations of medications, more or fewer medications in the same inhaler. And basically the mainstay of treatment in terms of inhaler treatment, so these devices that we use to inhale for treating COPD and to control the symptoms, they rely on bronchodilator medications. So medications that keep the airways open so they don't spasm as much, they don't close up as much. So you get a chance to breathe better, do more activity, get rid of some of that air that's trapped in the lungs between breaths. So the inhalers can help quite a bit with many cases of COPD. And there are now long-acting inhalers that can last the whole day, that may contain two medications, so two long-acting bronchodilators from two different pharmacological classes, so two different types of medication. And dual bronchodilator therapy is kind of the main thing that we use now for COPD, especially if it's going towards the more severe forms and one simple inhaler doesn't cut it. So we can try and go on that one, so you can check with your doctor which inhaler is the right for you. It's important to use a device that you can use easily, that you can administer the medication correctly. Now, if you have a form of COPD where you do get a lot of flare-ups, so you do get a lot of infections, or you need to change your medication, you need to take, for instance, oral corticosteroids such as prednisolone very often in a year, maybe once, twice, 3 times, more than that every year. There is a place for using also a little bit of a low dose of inhaled corticosteroid, which is much less than you would get in a tablet that you would swallow, but that low dose can keep some of the inflammation under control in the lungs and prevent some of these flare-ups. So this could be for the people that are frequent exacerbators. So this is basically people who have COPD, but they have a lot of these flare-ups. And that's where we have triple therapy as well. So these are inhalers that contain 3 types of medication. So you have the 2 bronchodilators that work in different ways. So do different classes of long-acting bronchodilators that last the whole day. But also in that inhaler, you also have a slight tiny dose of an inhaled corticosteroid. So these would be things like Trelegy, for instance. This is an example of an inhaler. Trimbo is another one. So basically medications, I'm not saying that one is better than the other. You need to be on the right inhaler for you, but you have more medication in the same inhaler, so that can be helpful for some people. On the flip side, even though that this is in vogue, let's say at the moment, to use the triple therapy because you just need to use one single device, for some people that doesn't work. So again, this is where you need to work with your healthcare provider to see which inhalers are the right ones for you. Even though we have modern inhalers that seem to be the latest ones on the market, for some people actually using the simple ones that they've been used to having for many years, they know how to use them really correctly, are the better choice. So it's not always that the more expensive inhaler is the better inhaler. It just depends on each person's situation. Now, the other thing that is pretty important is to try and to keep physically active. So this is where I think former programs such as pulmonary rehabilitation, which I personally don't like the name that much, but pulmonary rehabilitation basically consists of a formal program in which you work with a physiotherapist, usually in a group setting, to try and learn how to do exercises that strengthen your respiratory muscles. And this is a really, really important intervention because it can actually reduce how often you flare up, you exacerbate, how often you go into hospital, because you are able to cope better with the breathing problem. So if your muscles are stronger, you can imagine that if you are getting a chest infection, a pneumonia or something like that, you may be able to actually cope in the community without having to go into hospital because you're not as unwell and you're able to deal with more. So this is one thing. But then pulmonary rehabilitation is a formal program and not everyone in the world has access to that, and I appreciate that. So even just walking, simple walking up and down stairs, going to the park, going outside, going somewhere for a walk, moving around the house if you're having a more severe form of COPD, just keeping in mind there's being active generally, not necessarily doing something specific. There's not necessarily a specific exercise that you need to use for the lungs. Anything that makes you a little bit breathless and panting probably is an exercise for the breathing muscles as well. So you can imagine if you're walking in the park and you become breathless and you start to pant, just maybe go a little bit further, but then stop, rest up for a bit, and then continue and keep doing that. And that's actually a form of exercise that's really, really effective for the lungs. It doesn't have to be more than that, but that can help you. So again, not putting yourself in danger. You don't want to just exercise suddenly if you're having contraindications. So for example, if your doctor has mentioned to you that it's unsafe to exercise really hard, because of a heart condition or something else, COPD in itself, by itself, is not necessarily a contraindication unless there's something else going on. Say, if someone needs a lot of oxygen or something like that, where they may need the oxygen whilst they're exercising. So again, talk to your doctor and see what your situation is. But for most people with COPD, exercising in any capacity, walking, swimming, gym, whatever works for you, a formal pulmonary rehabilitation program if you can, just to learn better techniques for kind of moving around and working with the physiotherapists to clear secretions from your lungs and so on. All of these things can help. So I think it's really important. And then there's another thing I wanted to mention here. There is this correlation in many scientific publications around the strength in the quad muscles, in the quadriceps muscles in your legs, and survival. So for chronic diseases, for various chronic diseases, and it's the same for COPD. So if you have stronger legs, it means that you are able to do more. It means that you have a better balance. So there's fewer risks of getting into dangerous situations. So for instance, if you have poor balance because you've been deconditioned by not being able to exercise, you're really breathless, you've lost a lot of muscle mass. when you get up from a chair, when you're trying to go up the stairs, you're in your bathroom, there's higher risk of a fall. And this can be very difficult for someone who has COPD because it can really set them back a lot. We actually have sometimes admissions into the hospital of people who have had a long lie after a fall, because basically they've fallen in their house, there wasn't anyone around, they couldn't get up. And really, it's bad because then a lot of things go out of sync. People end up staying in hospital for a long time with a lot of organ problems, just because they couldn't get up. So really important to try and keep the balance, keep the stability there. The other thing is oxygen therapy. So oxygen therapy psychologically is difficult to accept because a lot of people see it as a terminal situation when people just use oxygen to palliate symptoms for an event, for the end. And it's not necessarily the case. So a lot of people with severe COPD actually need a little bit of oxygen. Not everyone needs oxygen. So first of all, you need an assessment to check whether your oxygen levels in your blood are low. And then we would top up the oxygen as needed. So oxygen requires a prescription. It's not given to everyone as and when, because it can be dangerous, especially in people with COPD. If we use too much oxygen and you are retaining carbon dioxide, you can actually become really unwell, comatose, end up in hospital, etc. So it's important to have a formal assessment to see whether you would need oxygen. This would be done with your healthcare provider, different arrangements in different countries. But it can be helpful because using oxygen can actually reduce the strain on the right side of the heart through different reflex mechanisms in the blood vessels in the lungs. It can help you do more, and it can actually improve your survival long term. So it's something that's really important to consider. So the oxygen therapy, but again, you need to be formally assessed. And there is another thing that I want to comment on here. So sometimes people feel that they need a lot of oxygen because they're really breathless when they have COPD. And sometimes actually the correlation between the blood levels of oxygen and the degree of breathlessness is not the same. So they may not go in parallel. So sometimes you can have people who are significantly breathless, super breathless, and actually they don't need extra oxygen, but they benefit from a flow towards their lungs, towards their face. So sometimes just using fan therapy, so actually using a handheld fan or having a fan blowing air towards the face can actually relieve some of that breathlessness. And this has been described in several studies. So again, in those situations, it's not always the oxygen that you need because the flow that you get through the nasal cannula that you have there is probably not enough to get rid of all the breathlessness. It may help if it's helping your heart and so on, but it's actually that flow that relieves the breathlessness. So that's another comment that I wanted to make. Now, in severe emphysema, so people who have really bad emphysema, which is a component of COPD, as I've explained in the previous video, sometimes there may be a role for some procedures to be done, some interventional procedures. And these could be either through a bronchoscope, through a camera test, so to place some valves or coils that would reduce the volume of these areas of the lungs that are not basically functional or not working. They've been damaged. They just take up space within the chest, but basically they're not really working and they're compressing the actual healthy lung that you're using for breathing. So in some cases, you can use these procedures to reduce the volume. It's called a lung volume reduction surgery or procedure. So like I said, you can have it done through coils or valves that are placed through a camera test, through a bronchoscopy procedure, or sometimes it can be a surgery. But again, this is reserved for severe cases of emphysema where there needs to be a lot of criteria met, basically. Not everyone can have it with severe emphysema. It requires that the lung tissue that's around the area that's hyperdistended, that's taking up space, is actually healthy, that there are no communications. So for instance, if we block off an area of the lungs through the bronchoscope, but then there's another communication and the air goes back and fills that cavity, again, there's a lot of nuance there, so I would urge you to discuss with your healthcare provider if you have severe emphysema, whether that's something that's beneficial for you. And again, risk-benefit to consider for any procedure. How is that really going to affect you? So that's there. And the other thing you can do to try to prevent from, COPD from getting much worse and actually living well with it is just to have regular follow-ups. So it's really important to think about other conditions. So everything else that's going on with your health. So someone who has severe COPD, for instance, probably will have some other conditions as well, maybe cardiac related, maybe they have diabetes, I don't know. It could be a lot of things that could be going wrong. So just fixing as much as we can from all of these angles, all of these conditions, doing enough exercise, not smoking, all of these things can actually help. And then if you see your healthcare providers regularly, there's an opportunity to discuss things, to make sure that you have the right investigations in a timely manner. And then any complications are caught early, so the treatments that you need are simpler. So the other thing that I wanted to mention is just thinking about other issues. Are you getting a lot of infections? For instance, if you're getting a lot of chest infections, for instance, if you're getting 2-3 more chest infections, you require antibiotics, maybe short courses of steroids every year. It could be worth exploring with your doctors whether you would need to be on a long-term antibiotic therapy to reduce the number of infections that you're getting, because every time you get a bad infection and you have COPD, you may lose a little bit of the lung function. Your condition may progress a little bit due to that excessive inflammation that you get. Now, it may not always be possible to stop those infections, but you may be able to reduce them. And just having fewer exacerbations lowers your risk of going into hospital, of having a bad outcome from that. In some instances, you can use vaccines as well. So, for example, getting the pneumococcal vaccination to prevent pneumonia. So this is for a specific bacteria that causes pneumonia and a lot of chest infections, especially in people with chronic respiratory disease. Having that vaccination done, it can be beneficial. Some of these vaccines can be done you only need to do them once in your life. For some, you may need to renew them every 5 years. So it's actually not a very significant intervention, but it can help a lot. Again, flu vaccination, I think, is really important. So if flu can catch anyone out, to be honest, even if you're young or old, and some strains of flu can be really, really bad. And I mean, as a pulmonologist, I've seen really bad flu in the hospital. People can end up in intensive care, even if they're not really unwell. But add to that, if you have a chronic respiratory disease, it can be really bad. So just having the yearly flu vaccination is probably useful, because it gets updated every year with the new strains that are circulating. So that can be helpful. COVID vaccinations, I don't want to get into it too much because I think it creates a lot of controversy. But if you have a chronic respiratory condition, probably, and if there is a lot of COVID going around, I think it's probably helpful. I think it's turned into an endemic virus that is still with us, unfortunately, so we may need to use these if we have chronic respiratory disease. I don't want to comment further on that because I know a lot of people find it very controversial, and I'm not trying to upset anyone, just kind of giving you a bit of an overview of what we have out there. Now, the other thing to consider if you're trying to prevent the worsening of COPD is, like I said at the beginning, you're trying to not smoke, but that's for you to make your decision, try to push through it to not smoke anymore, replace the cigarettes with something else. But also try to consider that there could be smoking or smoke inside your house from other sources. So if there is a lot of passive smoking, for instance, if there are a lot of people in your family who smoke, you might want to ask them to try and quit with you. I mean, that's going to be really difficult. I think it depends. You will know your family dynamics better. But if you live in a house where a lot of people smoke inside the house, maybe you can ask them to smoke outside because you've got this condition, which, so the smoke inside the house can affect you because it will be there. You'll be living in the smoke. So that's definitely not going to be healthy for the lungs. Also, if you have stoves or, cooking stoves or fireplaces and so on in the house, it's really important that the chimneys are really well cleaned regularly so that you don't have a lot of that smoke coming back in to the house. Or if you are, using these indoors, just having your windows open frequently to try to remove some of that lingering smoke. If it smells like smoke in the house, probably there are some particles that you're inhaling, so it could be bad for your lungs. Again, other things that are causing smoke. Are you using a lot of scented candles and other things? Do you really need to use them? So just kind of being aware of possible sources of indoor pollution. So that's something to really think about it as well. If you're still working, then so if you're going to your job and then your job involves inhaling a lot of dust or fumes, if you're a builder, if you're working in some kind of a chemical plant in a mine, etc., making sure that you use the correct personal protective equipment. So that is masks with a filter that filter out the air. So you want to use an FFP3, FFP2 mask at least. I know it can be difficult if you're working in a stuffy, hot environment to use that mask, but you may want to consider whether that is the right job for you if you already have a really bad condition. So workplace exposures, trying to limit those as much as possible, given the complications around that. I know it can be difficult if that's your livelihood, if you don't have an alternative job, but if you must go, just try to use protection. So to protect your airways. Surgical masks on their own probably are not enough because there's lots of holes around them. So you really need, an FFP2 mask at least, or an N95 mask, just to protect your airways. Make sure it's really sealed up around the nose and mouth so that you're inhaling less and less. And then, like we've discussed about repeated infections, so that's important. But then also consider that, like at the beginning, not all situations can be stopped. So not all cases of COPD can be stopped from progressing, and that's also down to genetics. So some people have something called alpha-1 antitrypsin deficiency. So this is most commonly found in cases of severe COPD, especially in people who develop COPD quite young, and they haven't necessarily smoked that much or had a lot of occupational exposures. If you feel that that's the situation in your case, it might be worth talking to your doctor and being screened for alpha-1 antitrypsin deficiency. So this is basically a certain protein that can lead to basically more oxidation in your lungs. So if you are missing that protein for genetic causes, it can cause your lungs to become oxidized and basically can become damaged by less amounts of pollution and smoke than in other people. So knowing that can kind of lead to lifestyle changes and so on. So that's really important to keep in mind, because some of these things can be looked into. So this video has been quite long now. It's about 20 minutes already. I'm not sure if you're still with me, if you're still listening to this, but as you can see, there's a lot of complexity in treating COPD, and trying to stop it from progressing probably requires a multidisciplinary approach. You may need to see different physicians, different healthcare providers, that can advise you on different aspects that you may be able to control. Some of the aspects are not within your control, so predispositions and so on. Sometimes the environment, we cannot control that. But some of the things you may be able to control, and if you cannot at least stop it completely from getting worse, at least slow it down as much as possible and have a good quality of life. So living well with COPD. Hopefully this was helpful. If you have further questions, do leave them in the comment section below, and I'll see you in future videos. All the best and good health.